charges against 324 defendants for their alleged participation in healthcare fraud schemes involving approximately $14.6 billion.
What does it take to catch the biggest healthcare scam in American history? Not a tip from a whistleblower, not an undercover agent, just raw data, millions of medical records, insurance claims, and billing codes. And the algorithms are smart enough to read between the lines. This is the true story of how the FBI and the Department of Justice uncovered a $2 billion web of fraud, using data mining to track down doctors, clinics, and corporations gaming the healthcare system on a massive scale. The scam was hidden in plain sight, and it took a new kind of investigation to tear it down. Why healthcare fraud is so hard to detect? The U.S. healthcare system is a $4 trillion machine, a vast, sprawling network of care providers, insurers, and middlemen, all generating data at breakneck speed. That includes private insurers, Medicare and Medicaid, hospitals, pharmacies, clinics, billing companies. Each of these players operates with its systems, policies, and billing procedures. Now imagine trying to track fraud with this complexity, hidden in plain sight among billions of transactions, dispersed across multiple states, and buried in dozens of disconnected databases. It's like looking for a needle in a field of haystacks, not just one. Traditional investigations, they're too slow. By the time red flags are identified through audits or manual reviews, the perpetrators have already moved on, often to new schemes, new shell entities, and new geographic locations. Fraudsters are agile, creative, and constantly evolving. They know the system better than most, and they exploit every loophole with precision. Paper trails vanish, digital records get manipulated, and whistleblowers? They're rare, often silenced or ignored due to fear of retaliation or lack of incentive. The system wasn't built to catch fraud, it was built to move money and services fast. It's a never-ending game of cat and mouse, except the cat is blindfolded and the mouse has a GPS. But what if we change the rules? What if instead of chasing fraud, we let the data do the hunting? That's where real progress begins. The future of fraud detection doesn't lie in more manpower. It lies in smarter algorithms. The case that changed everything. It started with an anomaly, just a blip in the data, until it wasn't. In 2019, federal investigators began noticing strange billing patterns tied to expensive genetic cancer tests. At first, it looked like a fluke, a sudden increase in Medicare claims for high-end diagnostics that typically cost over $6,000 per test. But as the data piled up, the pattern became impossible to ignore. The claims were coming from small towns, places with fewer specialists, lower patient volumes, and no clear reason for such a surge in advanced testing. Investigators dug deeper. What they found defied logic. The patients? Most had never visited the ordering physicians. The tests? Rarely, if ever, medically necessary. The providers? Some were billing for hundreds of identical claims every week, rubber-stamped, mass-processed, and sent straight to Medicare for reimbursement. It wasn't just suspicious, it was mathematically impossible. The sheer volume and uniformity of the claims made one thing clear: this was fraud at scale. And it was just the tip of the iceberg. What followed was one of the largest coordinated takedowns in U.S. healthcare history. Federal agents uncovered a nationwide web of telemedicine companies, marketers, doctors, and testing labs, many working together to exploit a lucrative loophole in genetic testing reimbursements. Over $2 billion in fraudulent claims were linked back to this scheme. This single anomaly, the red flag in the data, triggered a chain reaction. It showed investigators the power of analytics. It proved that when used correctly, data doesn't just tell a story, it uncovers the truth. And sometimes that truth rewrites the rules of the game. Key takeaway number 1. The FBI now uses data like a weapon. The FBI, working in close coordination with the Department of Justice, or DOJ, and the Department of Health and Human Services, HHS, has fundamentally changed how it investigates healthcare fraud. Instead of relying solely on tips, audits, or post-fraud investigations, They built something smarter, a predictive fraud model designed to hunt fraud before it strikes. They fed it massive data sets, including Medicare billing records, geographic claim density by zip code, patient demographics and histories, provider identities and affiliations, payment timelines and reimbursement speeds, known red flags, like repeated use of specific billing codes or suspicious clusters of identical claims. The outcome? A dynamic nationwide heat map that highlights areas of elevated fraud risk in real time. This wasn't just a better way to track fraud, it was a completely new way to fight it. Instead of reacting to crime, investigators began predicting it. They started generating leads, not waiting for them. The system could detect abnormal billing behavior faster than any human team, flagging providers long before an official complaint ever surfaced. This is what law enforcement looks like in the age of machine learning. Data as surveillance, models as weapons, and prevention as the new priority. In a system this large, the only way to outsmart fraud is to outcompute it. What they found was staggering. Once the data model lit up with suspicious activity, investigators followed the digital trail, and what they uncovered was far more elaborate than anyone expected. This wasn't a case of a few bad actors. It was a coordinated, nationwide fraud scheme that spanned multiple industries and states. The scam involved fake telemedicine companies are set up solely to generate claims. Doctors who signed off on thousands of expensive genetic tests without ever speaking to the patients. Laboratories that processed medically unnecessary or outright meaningless tests. Recruiters who cold-called seniors or targeted them on Facebook, offering free cancer screenings in exchange for Medicare numbers. Shell companies that funneled the profits through layers of LLCs to obscure the money trail. Total damage? Over $2 billion in stolen taxpayer dollars. That's not a typo. Billions vanished from a system meant to serve the sick and vulnerable. The scheme was sprawling. It reached into urban hospitals and rural clinics. It pulled in hundreds of medical professionals, some fully aware of the fraud, others misled by bogus contracts, fake job offers, or consulting arrangements that masked illegal activity. This was healthcare fraud on an industrial scale, and without data-driven detection, it might have continued for years, hidden beneath the surface of legitimate care. The data patterns that gave it away. Once the FBI's predictive model was deployed at scale, the real story began to emerge. Not from confessions or stakeouts, but from the patterns buried deep in the data. What had once looked like isolated blips suddenly aligned into a clear picture of fraud. Some of the red flags were impossible to miss. A single physician billing for over 1,000 genetic tests per month, far beyond what any legitimate practice could handle. Clinics submitting identical claim types within minutes of each other, across different patient names and dates. Medicare ID numbers reused in multiple zip codes, sometimes hundreds of miles apart, suggesting stolen identities or coordinated submission rings. An explosion of new shell companies, all registering in rapid succession, with near-identical LLC structures and ownership patterns. These weren't just coincidences, they were data fingerprints, unique digital signatures left behind by even the most careful fraudsters. And once the model was trained to look for them, the system lit up like a Christmas tree. Even smarter criminals couldn't stay hidden. No matter how many fake firms they created or how fast they tried to pivot, the data caught them. Patterns don't lie. With a clear map of the network, timelines, and transaction trails, the FBI had what it needed. The case wasn't just strong, it was algorithmically undeniable. Key takeaway number 2. Modern fraud isn't just greedy, it's engineered. This wasn't some lone doctor in a back room trying to game the system. This was bigger, smarter, engineered. What investigators uncovered wasn't just fraud, it was infrastructure. Every part of the scheme was deliberate, planned, and optimized for profit. This was a full-scale operation, more startup than scam. Key components included data brokers, purchasing patient lists, including names, ages, Medicare IDs, and medical histories, creating a pipeline of easy targets. Lawyers, drafting shell contracts and service agreements designed to look legitimate, shielding key players from liability. Tech teams, building back-end systems to automate claims filing, ensuring thousands of submissions went out per day without human input. Recruiters, trained in professional-grade sales scripts to cold call seniors, often using fear-based language to push unnecessary tests. Payment processors, and financial pros setting up laundering networks, layers of bank accounts, LLCs, and offshore entities to wash the money clean. This wasn't about finding a loophole and sneaking through it. They studied the loopholes. They reverse-engineered the billing system. Then they built an entire business model around exploiting it, scalable, repeatable, and dangerously efficient. That's the reality of modern healthcare fraud. It doesn't look sloppy. It looks like a company. And without data, it would have looked legitimate. The fallout: raids, arrests, and reforms. Once the data painted a clear picture, law enforcement moved swiftly. The FBI, DOJ, and HHS coordinated a massive takedown operation that spanned more than 20 federal districts. This wasn't a quiet cleanup. It was a nationwide crackdown. The results were staggering. Dozens of doctors indicted on charges ranging from healthcare fraud to conspiracy and money laundering. Multiple labs shut down, with licenses revoked and operations seized overnight. Millions of dollars frozen or recovered from offshore accounts, hidden trusts, and fake consulting firms. Several fraudsters attempted to flee the country, but were intercepted at airports or border crossings. One ringleader was found with $3.5 million in cash, stashed in bags, closets, and even under floorboards. This wasn't just a win for law enforcement. It was a proof of concept, a new kind of investigation powered not by chance, whistleblowers, or long-tail audits, but by algorithms, anomaly detection, and data models that predicted where fraud would surface next. The operation became a model for future cases. It showed that when the system is too complex for human oversight, numbers can tell the truth. Data doesn't forget, it doesn't lie, and when used the right way, it can take down even the most sophisticated fraud networks. How this changes law enforcement. This case didn't just uncover a massive fraud ring. It transformed how white-collar crime is investigated in the United States. For years, the model for uncovering healthcare fraud was painfully reactive. Old model: wait for a whistleblower to come forward. Launch a slow, often years-long audit. Piece together paper trails and hope for a confession or plea deal. It worked sometimes, but only after the damage was done. Billions were lost before the first red flag ever reached an investigator's desk. Now there's a new model, and it's turning the tables. New model: use anomaly detection to scan massive data sets in real time. Flag statistical outliers, providers billing outside the norm, patterns that defy logic. Launched targeted raids, backed not by hunches, but by clear digital evidence. This is cyber forensics meets healthcare fraud, a new era where machine learning tools work alongside investigators, guiding them to the source faster than ever before. It's not just more efficient, it's more effective. By using data as a primary weapon, law enforcement can act proactively before the next billion vanishes. The success of this case proved the model works, and now it's being scaled nationwide. The message is clear: if you commit fraud, you can run, but your data won't. Key takeaway number 3: the future of fraud fighting is algorithmic. With billions of healthcare claims processed each year, traditional methods of fraud detection simply can't keep pace. Human investigators, no matter how skilled, are outmatched by the volume, speed, and complexity of modern healthcare billing. That's why the future of fraud fighting is no longer manual, it's algorithmic. Today, the FBI, and increasingly, private insurers, are turning to advanced technology to level the playing field. They're using machine learning models trained to identify emerging fraud patterns that don't yet have a name. Anomaly engines capable of detecting sudden shifts in provider behavior, even subtle ones that escape the human eye. AI triage systems that prioritize cases by financial impact, helping agents focus on the biggest threats first. Natural language processing, or NLP, to scan social media, contract filings, and shell company registrations for connections that point to hidden networks. This is no longer just about protecting Medicare. Private insurance companies are now adopting similar tools, building real-time detection systems that act as fraud firewalls, using their own claims data to predict and prevent abuse. The arms race has shifted. Fraud is evolving, but so is the defense. In this new era, the best investigators aren't just in the field, they're in the code. What it means for doctors, patients, and taxpayers. The crackdown on healthcare fraud and the new data-driven tools behind it have ripple effects that reach far beyond the investigators' offices. For honest doctors, the impact is immediate and tangible. They now face increased pressure to meticulously document every test, every procedure, and every code submitted. Compliance isn't optional, it's mandatory. While this means more paperwork and audits, it also helps protect them from false accusations and ensures their legitimate work stands up under scrutiny. For patients, the changes introduce a new level of transparency and safety. There's now tighter oversight on who is billing your insurance for your care, how often expensive or invasive tests are ordered, which laboratories process your samples. This scrutiny helps prevent unnecessary procedures and protects patients from being caught in fraudulent schemes without their knowledge. For taxpayers, the promise is a measure of relief. Every fraudulent dollar caught is money redirected back into the system. Less waste, less abuse, and a stronger foundation for everyone who relies on Medicare and Medicaid. Ultimately, healthcare reform isn't just about laws or policies. It's about pattern recognition. Recognizing the signs of fraud in the data, recognizing the value of transparency, and recognizing that protecting a $4 trillion system requires innovation, vigilance, and trust. Where the FBI goes next. Armed with the success of their data-driven approach, the FBI and DOJ are not resting. They're applying this proven playbook to tackle emerging and evolving threats across the healthcare landscape. Among their top targets now, COVID-19 relief fraud, which surged during the pandemic as billions in emergency funds were rapidly distributed, often without sufficient oversight. Complex schemes involving pharmacy benefits managers, or PBMs, who control drug pricing and reimbursement, sometimes exploiting opaque contracts to overbill insurers. Durable medical equipment, or DME scams, where overpriced or unnecessary wheelchairs, oxygen tanks, and other equipment are billed en masse. Continuing battles against fake billing and telemedicine, as virtual care expands and fraudsters exploit the remote nature of the service. To coordinate this effort, federal agencies have built a central fraud prediction hub, a shared intelligence center powered by AI and machine learning, where data flows seamlessly between the FBI, DOJ, HHS, and other partners. This isn't about catching up anymore. It's about staying ahead, anticipating the next wave of fraud before it can take root, turning billions in data into billions in savings. The message is clear. Healthcare fraud may be sophisticated, but so is the defense. The big picture. Technology is changing justice. This case isn't just a story about healthcare fraud. It's a window into the future of law enforcement and justice itself. Technology is transforming how crimes are detected, investigated, and prosecuted. In this new era, data isn't just evidence, it's intelligence. Traditional investigations relied heavily on tips, witnesses, and painstaking manual audits. Now, with billions of data points at their fingertips, investigators can detect fraud before the damage is done, shifting from reactive to proactive law enforcement. This means catching patterns, not just people. Algorithms identify suspicious behavior across vast data sets, linking actors who might never have crossed paths otherwise. Fraudsters used to hide in the noise. Today, their fingerprints are laid bare in the data. The speed of justice has accelerated too. Cases that once took years to build can now be constructed at algorithmic speed, with clear, quantifiable evidence that stands up in court. Fraud hasn't disappeared. It still exists and adapts, but hiding it has become a lot harder. This case proves that when technology and human expertise unite, justice evolves. It becomes smarter, faster, and more effective. This is just the beginning. The future of law enforcement will be defined by data-driven insight and the power to bring criminals to light before they do lasting harm. The largest healthcare fraud in U.S. history wasn't cracked by chance. It was cracked by code. Because in the digital age, the smartest detective isn't always human. Sometimes it's a spreadsheet, an algorithm, or a string of outliers flagged by a model no criminal saw coming. Subscribe for more true stories where data science meets justice. And tell us in the comments, is healthcare fraud a tech problem, a policy problem, or both? Stay blessed and stay curious.